The first one I would say is just predictive visibility. We know predictive analytics exists. AI is giving us the ability to see issues before they happen. So instead of looking back, like I mentioned earlier, on why a patient dropped off therapy, we can now predict things. The second is turning insights into action. It's not just about knowing who's at risk, it's about knowing what to do next. And that's where next best action models are helping field and patient services team take the right steps at the right time. And then the third thing I would say is just trust and transparency. So, in these high stake areas, I mean, these are very high stakes. No one wants a black box. The
Mm.
AI that truly makes an impact will be the kind that explains why it made a prediction. If you get these three things right, so clarity on the problem, like really fall in love with the problem, not the solution, like clarity on the
Mm.
problem, transparency in the model, and then the people empowered to act, AI can become a force multiplier for patient access and care. Sky's the limit here.
Hello and welcome to the Digital Health Transformers podcast. This series explores innovation in healthcare, one conversation at a time. I'm your host, Marty, and today we are joined by a truly distinguished guest whose work bridges technology, product leadership, and healthcare outcomes. So our guest today is Meghna Misra, head of product at Claritas Rx. Meghna is a business-driven product executive with 18 plus years of experience transforming innovative ideas into market-leading SaaS and mobile products. Her career blends a strong engineering foundation with leadership roles at both startups and industry leaders like Intuit, Microsoft, Pure Storage, and NetSmart. She is recognized for her ability to balance risk with a keen sense of product strategy, having launched groundbreaking 0 to 1 products and scaled complex healthcare platforms to deliver better visibility and improved patient outcomes. Today, we're going to discuss how AI is reshaping patient visibility, identifying risks before they happen, and transforming healthcare delivery. Meghna, thank you so much for joining us today.
Thank you, Marty, for having me.
Your career spans startups and large enterprises, and you have led complex healthcare and technology products. And I'm wondering what inspired you on focus what inspired you to focus on AI above other technologies, especially when it was early, and now everyone's using AI, but before not everyone was using AI. What inspired you to focus on using AI to improve patient visibility?
Oh, that's a great question to start this podcast with. For me, it really comes down to impact. Throughout my career, whether it's been at startups or large enterprises, I've seen how fragmented the healthcare system can be and how difficult it is to get the full picture of the patient journey. And that lack of visibility, that often translates into delays in care or missed opportunities to support patients. And so, like you said, AI obviously is the hype right now, but I have been focusing on this for a while now. And what inspired me about using AI is its ability to cut through that complexity, to bring together data from different sources, the ability to surface insights faster, and make this super complex process more proactive instead of being reactive. And then at Claritas RX, that's the company I'm at right now, I've been especially motivated by the chance to apply AI in a way that brings biopharma and specialty pharmacies together, helps them better understand where patients are getting stuck and how to support them effectively. So, as you know, Claritas RX, we are the leading providers in the specialty and rare therapy markets, also CAR T. And so these are patients who have a need to get unblocked and get to therapy faster and stay on therapy faster. So for me, it's not AI for the sake of technology. I mean, that part is definitely super cool, but it's about using it to make a very real difference in our patients' lives.
Oh yeah, I think that just makes me happy when I hear that response because I see, I'm scrolling LinkedIn, I'm doom scrolling LinkedIn, and it's a lot of, because you said it straight up. It's not AI for the sake of technology. A lot of stuff out there I feel like is like AI for its own sake now. Just so you can
Mhm.
slap it on your company title, tell a VC. You know,
Yeah.
I think I saw a post earlier. It said if you haven't changed your company's domain extension like .com.org to .ai yet, you're not going to make it in 2025. So
Gosh, yeah.
yeah, just hearing that, like, you're really thinking about how do we apply AI for a problem. I don't know. That's really nice. So, um, yeah, just a little reactionary response there. Uh, another question I have is, how has your experience building these digital products in healthcare and beyond throughout your career? How has it shaped your approach to designing tools that are going to, proactively identify patient risks at Claritas?
I've been building products for a long time, and I have learned a lot. What I've specifically learned from building digital products in health tech is that the strongest products start with truly understanding the problem at their core. So I focus on building products that proactively identify patient risks. I do that by embedding predictive insights directly into workflows so care teams can act before risk escalates. You don't want to take your users out of the workflows. I do believe in designing products that take a design centric approach, digging into patient journeys and user workflows, like I talked about earlier, to uncover these friction points and opportunities for timely intervention. That means combining AI driven models because they do
Mm.
work, seamlessly integrating data, and then applying human centered design, making sure that every insight that we surface, every analytic that we provide to our users, they drive meaningful action. And so for me, product leadership is about building with intention, aligning technology, empathy, and rigor, and using those three pillars to empower teams, reducing friction in the product, and then ultimately delivering personalized, measurable outcomes. I mean, the goal here isn't just to build products, like I said, or just identify risks or surface insights. It's really about transforming how we think about care and doing that proactively as opposed to reactively.
Yeah. Because if you think about what AI is good at, right? It's like
Mhm.
prediction. Using all this
Yeah.
data, putting it through a big old GPU data center, bloop bloop bloop, and then you have a
Applying all your
prediction.
models to it. I think,
Oh yeah.
everybody is sitting on a lot of data. It's
Mm.
what you do with that data. And then how do you build these products like that? How do you apply that craft of product management where you're building products that truly delight?
Mm. Yeah. No, that's yeah, anything with like predictive, I'm a big Brian Johnson fan and he's really bullish on AI cuz he uses it, Brian Johnson, right?
Hmm.
The man who's trying to live forever. Um he's like, I think AI is going to make us immortal because it's so good, or like live really long, bigger than any other medicine, because he said that it's so good at predicting things, right? Taking all the data, predicting things, so it can predict, um, what's going to make us healthier,
Yeah.
and it's
It,
going to
it can do a
be,
lot of predictions and really cool,
yeah,
not
yeah.
just cool predictions, but impactful ones. I mean, we have
Mm,
so many use cases and case studies from those
mm.
use cases where we've applied AI and seen tangible and meaningful impact in our patients' lives. Yeah, well, someday I'd be happy to share those with you.
Yeah, no, it's great. It's great. It's great. You guys, Tempest, it has been like Have you seen Tempest? Tempest stock? Tempest stock is crazy right now.
No, I haven't. I'll look it up once I get a chance.
Yeah, no, but like this, AI. I think,
Look how Nvidia is doing the stock prices through the roof. There are
and
so
in,
many different
yeah,
companies. And we do leverage a lot of the models. We do leverage the improvements, not just in building our product, but also how we do our work, analysis of data, making sure that we have the right tools available for our customer success
mm,
teams. So we are at the forefront here, not just in building our product with AI baked in the DNA, but also in leveraging tools that are out there.
yeah, no, that's great. That's that's I think I'm gonna try to invest in Claritas whenever it goes public.
I will let the team know that. They'll be happy to hear.
Yeah, like my like $100.
Yeah, we're still
like a,
we're still venture
like a-
backed, right? Yeah, yeah, private company, but I am quite happy with the way things are going.
oh yeah, no, it's I think it's gonna be big, this whole AI thing, and with healthcare, it's nice. Yeah, so hey, AI has been transforming healthcare, decision making, like we're talking about. And so, from your perspective, then, what are the most impactful way? We already kind of touched on this a little bit. What are the most impactful ways that AI can improve the patient visibility and predict the potential risks, before they escalate? But what, like the more particular ways, like what is AI really good at right now, when it comes to prediction? Like maybe it's not too good at predicting cancer, but it's really good at predicting diabetes or something like that.
Yeah, and I'll keep my response specific to what we're doing because again we are talking about leveraging AI for real use cases, like use case backed. Um,
Mm,
I do think AI is really becoming a force multiplier in healthcare, especially in healthcare. It's helping us see patients more clearly by connecting the dots across, like I said, a lot of fragmented systems, pharmacies, clinics, access programs, hubs, specialty care. So what it's doing is it's helping us see that patient journey more clearly, and giving us real-time view of the whole journey. And that kind of visibility means that is quite unprecedented, that we can spot these risks super early on. So, for example, a refill delay or a coverage hurdle, like some financial hurdle, or signs that a patient is not as engaged in the therapy as they should be for it to be effective with maximum benefits. And so,
mm,
because we can see these risks early on, we have the ability to surface those and act before it affects our patient's care. And the real shift here is from hindsight to foresight. So AI can predict where barriers might appear, but also why those barriers are happening. So, it's one thing to say your patient is at risk. What's more important is your patient is at risk. We expect this risk to manifest 3 months from now, and here's the
mm,
reason why. So what we do is that we get all the data, obviously data that we have the rights to. We
mm,
also bring in social determinants of health data. We layer all of this, we run it through our models, and we are able to come up with like really our accuracy rates are very high and our precision is fairly good too. So we are able to do all of this so teams can step in early and personalize support. And like I've said before, AI shouldn't replace empathy. It should amplify it. As a product
mm,
leader, I'm super excited by a future where AI gives, in healthcare, AI gives every care team the foresight to act early and every patient the support that they need to stay on therapy and just be on a plan and a path to better health. So I'm very bullish about the future of AI in health tech.
okay, yeah. So it's really good at like detecting whether there's going to be a coverage hurdle.
Mhm.
I'm getting like a refill delay. These kind of like really annoying administrative problems that, or kind of get in the way a lot of the times. That's really important. I think that's actually. I think that's
Yeah.
great. That's better than what I was thinking, which is like just straight up like on the ground predicting someone's disease, because these things are what gets
Yeah, oh yeah.
way a
But
lot of
what you said about
times.
predicting diseases is also happening, where again, we're not, and this is not something that we do, but there are many companies out there.
Hmm.
And to my earlier point about it's not about replacing the doctors, it's not about replacing these health tech professionals who know what they're doing. It's about
Hmm.
giving them the right tools, amplifying it, amplifying the patient experience. I get my lab results, and yes, I will talk to my doctor, but I'd like to know what's going on there.
Hmm.
And AI can help with a lot of that too.
Yeah. Yeah. No, it's really nice what's going on for the patient. You know,
Yeah, for the
the
patient. For us, like, we are all patients in the
oh, for
health
you guys.
care system.
That's true. That's true. That's true. That's true. Um, yeah, I mean, it's gonna make us healthier. It's nice. Probably, solve a lot of the bureaucracy and the or not bureaucracy. What's the right word? Yeah, the administrative
The
things.
complexity,
That
all the
complexity.
complexity that healthcare has. And it's not
Oh
just
yeah.
about patients, right? It's about all the providers who are working so hard, the caregivers, the payers, the entire healthcare ecosystem.
Yeah. 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 For sure. Um, Yeah, we do at OSP too, and at OSP, like I see, like no, I see the numbers they put up. These guys are good. Like I'm like, wow, there's a real demand for people reducing this crazy complexity we got in America, at least in the healthcare system. You guys are doing it too, and it's just good to see. It's good to see the markets, doing its thing. It's
Mhm.
working. It's solving these problems. So but yeah, okay. So then, how can the healthcare providers and payers use these insights to improve outcomes, but then also balancing, their cost and their operational efficiency and these kind of things that providers are gonna face, and payers.
And that's a great follow-up question, Marty. Because just visibility that I talked about earlier, just visibility alone isn't enough. The real value comes when providers and payers can act on those insights. And with AI-driven analytics, they can make much more strategic decisions
Hmm.
that balance these outcomes that we talked about with cost and with operational efficiency. So, for example, they can spot when patients are getting stuck, whether that can be, access issues to the medication itself, adherence, or even coverage, and then focus resources, whether, no matter which industry you're in, resources are always tight. But having that level of transparency and visibility, it allows them to focus resources where they'll have the biggest impact. So,
Hmm.
they can benchmark performance across networks. They can streamline coordination between different stakeholders. And you talked about the administrative burden there. And all of this then reduces the administrative friction that slows care down. And what's powerful is that AI turns this into a continuous feedback loop. So it measures what's working, what's not, and then how these programs can be refined in real time. If you think back to the time, what is now the dark ages without AI, um, that entire feedback loop took literally months to happen because we just didn't have access to the data. And even if we did have access to the data, we weren't able to compute fast enough. And so ultimately, these insights will help organizations, spot patterns. It'll help them spend smarter, not just more. And then that in turn is going to lead to improved patient experiences, reduction in waste, and then generally accelerating the path to successful treatment for the patients. So all in all, I do believe that this is, the benefit is across not just the products that are being built in the market, but you can see these far-reaching implications on people's health, but also within the payers, within the providers, and also the cognitive burden, the
Mm.
reduction in cognitive burden for folks in the administrative roles. I want to come in the morning and see a list of, I wish my email, based on all the emails that have come in through the day, I get a list of, here, Meghna, here are your tasks the top tasks that you need to focus on. I'd
Mm.
love to get that summary. And, many of our products do that today.
Yeah. That's great. Doesn't it kind of freak you out when you have like a doctor who's like, he's like, I'm a little bit overwhelmed. I'm stressed out. It's like,
Oh,
well,
yeah.
what do you mean? You're giving me drugs and stuff. You got to be on your game. You gotta, you can't be. So if they have all their data there, it's easy for them. That as a patient,
And it,
that would
it
make me
helps with
happy.
cost management,
Oh
efficiency.
yeah,
Like, why are
yeah.
healthcare costs so high? Because a lot of
Oh
time is
yeah.
spent in administrative tasks.
Oh yeah. All the
Oh,
coding, all the this and that. I don't know. Oh my goodness. Yeah. No, it's great.
it's
It's
complex.
great to see. It's great to see organizations like Claritas in the industry, fixing it up. Really fixing it up. You know, a lot of people talk about, oh, you got to change policies and you got to change this, and it's true. But
It is
you
true,
guys are
though. Yeah.
you guys are you guys are just like, you know what? We're just gonna build. We're gonna build. We're gonna fix this by building, and you guys are doing that. You guys are making good money, and then you guys are solving real problems. It's pretty awesome. And even just talking to you, like you understand, like, okay, we're gonna use AI to do this. We're gonna use AI to fix that, and it's good. As a American patient, I'm very happy hearing these things. You know,
Yeah.
so and then talking about policy and policy making. What role do you see big healthcare leaders and policymakers, what role do they have then in ensuring these AI solutions are, effective, making sure they work, they're not causing some dystopian problems, making sure they're transparent, like people know what's going on, making sure they're equitable because we've heard about the problems with biases and whatnot in AI. So effective, transparent, equitable. How do you see healthcare leaders and policymakers making sure that these AI solutions stay effective, transparent, and equitable?
Yeah. So, you've called it out beautifully. I strongly believe that healthcare leaders, as well as policymakers, have a huge role to play here. So, for healthcare leaders, that means driving that culture of accountability, making sure AI decisions are explainable,
Mm.
that data that the AI models use, that data is of high quality and it's diverse. And that the technology actually works for providers, for payers, and patients, and not just around them. So I think that's something that healthcare care leaders really have to pay attention to. And as far as policymakers go, I'd say for them, it is about creating frameworks. I'm not going to use the word regulations, but rather frameworks
Mm.
that encourage innovation, but also encourage safe experimentation while making sure that patient privacy is protected, while making sure that there are mechanisms and these frameworks are preventing bias from creeping into the algorithms. So that structure is required, and I think the policymakers should be paying attention to that. Tying it back to what I said about healthcare leaders, the quality, it's garbage in, garbage out. The quality of
Oh.
data becomes very important. The diversity of data becomes very important. And then the cleanliness of data becomes really, really important. And so making sure that the data that's being fed into these models is accurate, it's diverse, it is, in a lot of ways free of bias, but also having the structure built into enhancing these models. So together between the healthcare leaders and the policymakers, I mean, at the end of the day, they do need to work together because only together can they foster collaboration. They can promote, high ethical standards and ensure that while doing so, AI's full potential can be harnessed to improve outcomes for not just a few patients, but for every patient. So it goes back to
Yeah.
that point you raised about, it being equitable, it being free of bias, and working for every single person, not just a select few.
Yeah, I love I love I love that you said, okay, let's not think about it like creating regulations. Let's think about creating frameworks. I really love that personally because like yeah, I feel like if you set out like okay, I'm a regulator, I'm going to create regulations. You're just going to, you're going to say you can't do this, you can't do that without end, even when it might hurt the patient,
Yeah.
And so yeah, creating a framework so that you're thinking about how do we focus on regulating the right things, like not just thinking about all right, well, what to regulate, but like what should these regulations look like, what should not be regulated, like framework, how it's going to actually look.
Frameworks.
I think that's really
Yeah.
smart.
And that's
I
why
think
it's
that's
important
really
for them to
smart.
work together because
Yeah.
um, our policymakers, they are not technologists. They are
Oh
not
yeah. No.
healthcare, the healthcare leaders understand the space much better than the regulators and the policymakers do, which is why it's
Yeah.
super important for them to be able to work together and understand the context there. Yeah.
Oh yeah. Yeah, yeah, for sure. No, like I watched the YouTube videos like of the live, like the Senate. They're like, I don't want Chat GPT to. I don't want Chat
Those are
GPT. They always
entertaining.
say the GPT part wrong. It's so funny. Okay, not anymore because it's 2025, but in 2023, and they if
I
you
know.
if you they don't want people to know this, but they like in 2023, 2022, they're like, I don't want Chat GGP to be my doctor, right? But if you're in the
Mhm.
field, like, okay, well, yeah, but the technology is going to get better, and that's what all the technologists said. These guys are like, no, stop it, regulate it, but that's like
Mhm.
just your point. Because at the end of the day, you're all supposed to be helping the people, the patient, right? So,
Yep.
but no, that's just I had a light bulb moment when you were talking about that just there. I thought that was very smart. So so then, on that, could you share some examples of how, AI driven tools have successfully, well, improved the patient visibility that you guys have seen or prevented any adverse events? So some examples of that.
Oh, yeah, absolutely. Like I said earlier, AI is giving care teams that real-time visibility into patient journeys, spotting delays, adherence issues, or potential drop-offs before they actually happen. And also, like, why is that adverse event or why is that risk happening? What's the risk factor behind it? And the results that we've seen at Claritas RX are very tangible.
Mm.
We've been able to, I would say, quantifiably, yeah, anecdotally, everybody says we have made a difference, but quantifiably, we improved brand performance with our customers. And I'm going to quote some numbers here where we've actually been able to achieve 20% increase in fill rates and greater than
Wow.
17% boost in refill rates. And that's huge for our segment where, we are
Yeah.
really focused, hyper focused on the rare and specialty disease, oncology and CAR T. Those are very material numbers and
Mm.
percentages. And so just by having these models for discontinuation prediction or refill abandonment or abandonment or cancellations, we are able to give insights to our customers, and they in turn do timely interventions. And that care coordination really helps patient not just start therapy but also stay on therapy longer, which in turn
Yeah.
means
Yeah.
that it's really helping them. So, and I mentioned this earlier that we've got like case studies where our AI models have been able to predict risk And it's really changed the way the team has worked with the patient and gotten them back on therapy. So it's use case backed. We see these tangible results, and hence we are making even more investment in ensuring that our product is driven by many of these machine learning capabilities and models.
Yeah, yeah. Yeah, like, it sounds like numbers there, like 20%, 17%. But I remember the last time, I had
Yeah.
to take a medication. I wasn't taking
Greater
it.
than 17% because it varies, from brand to brand.
Yeah, yeah. Um, but like, yeah, I remember the last time, I had to take a medication. I didn't take the medication. I was having I was having like shivers, like my hands were like cold, like my feet were like super cold, like this specific thing. I was like, what is going on? What in the world is going on? Because I was having withdrawals from this thing, and it was like, am I gonna die? And so just thinking that, it sounds like, oh, it's a 20% increase, right? But it's really, it's preventing that. It's preventing, real symptoms when
Mhm.
you help people, um, take their meds. It's pretty awesome. Just thinking about the actual tangible, what's going on there. It's really making, saving a lot of people from having a bad day. It sounds like. So that's pretty nice. And then looking ahead, then, okay, so what trends are you seeing then in AI and patient visibility? What trends do you see shaping healthcare delivery over the next few years? Especially because, we were talking about AI now, or AI in 2023, 2024. It was like kind of clunky. It was kind of, robot-y. It was like awkward, like it hallucinated all the time. Um, and then now compared to now, and then, okay, what's GPT-9 gonna look like? It's gonna be like Einstein all the time. And so we really want to know then, yeah, what trends in AI do you see shaping healthcare delivery over the next few years, given that context?
It's interesting you asked this question. We were actually having a discussion just earlier this week about this, and the way I think about these trends, like there are three big trends in how AI is changing healthcare, and especially in the rare and specialty disease and oncology space. So the first one I would say is just predictive visibility. We know predictive analytics exists. AI is giving us the ability to see issues before they happen. So instead of looking back, like I mentioned earlier, on why a patient dropped off therapy, we can now predict things like, oh, prior authorization is going to be denied, or abandonment risk early on to actually intervene. So that's the first one. The second is turning insights into action. It's not just about knowing who's at risk, it's about knowing what to do next. And that's
Mm.
where next best action models are helping field and patient services team take the right steps at the right time. And then the third thing I would say is just trust and transparency. So, in these high stake areas, I mean, these are very high stakes. No one wants a black box. The
Mm.
AI that really makes an impact will be the kind that explains why it made a prediction and how to act on it. So overall, I think the what we are seeing is that we are moving from having like tons of dashboards and reports and predictive analytics
Yeah,
to
yeah, yeah,
artificial intelligence as a true decision partner. So
yeah.
a partner, not replacing skill sets, but as a true decision partner, one that helps. In our case, these would be our customers are manufacturers of these drugs. So manufacturers, hubs that patients get enrolled in, and then the care team that provides the care coordination. So one
Mm.
that helps all these segments work together to improve access and continuity of care. That to me, I feel like a combination of the three things I mentioned is really where we are headed towards.
Yeah. No, that's great, and that what I think of like tangibly, especially that thing you said, the turning insight into action. You don't want to just know the data. You want to know what to do next. I got this Aura ring, and I love it. I love my Aura ring. This thing is awesome. I don't know if you know about the Aura ring.
And I have heard
It's
of it, but I don't use
okay.
it.
It's like
My friends
it's a
swear by it.
okay. They swear by it.
They swear by it.
Oh
They
yeah,
love it.
it's awesome because it has all this health data. It shows you know how much you slept, how much you had deep sleep, light sleep, REMs, all this stuff I didn't even know existed, to be honest, until I got the thing. But it's very overwhelming at first, at least. You know, it's just boop, 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 all this data, all this stuff, and it's like, okay, I'm happy that I you know I'm seeing all this data, but it's like overwhelming. What does this even mean? What should I do? Like,
What do you
should
do?
I
And
sleep
so tell
more?
me
Should I
what to
sleep
do.
less?
Yeah.
Exactly.
And
Yeah,
then
yeah. So yeah,
in our
yeah. Go
case,
ahead.
not just telling you what to do from an action standpoint, but also doing that for you. And that's where agentic AI
Yeah.
comes in, right?
Oh yeah, yeah.
Where, okay, now I know I need to take this action. I need to reach out to, and I'm just using this as an example, I know a patient is at risk, prior auth. I need to reach out to the provider. I would normally either pick up the phone and do it. How about you make that phone call for me? How about you send that
Yeah.
email for me? So that further, I mean, that's the transition that's going to happen, and it's happening really fast.
Oh yeah.
Well,
Yeah.
exciting times.
Yeah, it's great. No, I hate when I get a sat I get a SAS or something. You know, it's supposed to give me data. It's supposed to help me. Um, and then it's just all this numbers everywhere. It's numbers here, numbers there, numbers everywhere. And it's like, oh my gosh, just tell me what to do, dude. I
Hmm.
bought your SAS. Okay, I'm seeing all this data of my marketing analytics or something like that. Just tell me what to do.
What to do?
Because I end up screenshotting it and putting it in ChatGPT anyway. But you guys are on that. Um, like making sure, okay, we're not just gonna know, the problems. We're also gonna tell you what to do next. So that just stood out to me. I was like, oh, that's great that you guys are thinking about that. So Um, and then I guess before we sadly have to wrap up, I want to ask one more question about what advice would you give an organization that is beginning to integrate AI into patient care and risk management, being um, someone who has successfully done it, being from Claritas, which has done it in an awesome way. What advice would you give organizations that are just starting to or thinking about integrating AI into their patient care and risk management?
Well, Marty, that is an awesome question. And one I think that a lot of organizations are wrestling with right now. They're grappling with, like, everyone's talking about AI. In order to be viable in the market, I need to do something with AI. I literally have heard people say these words, I need to do something with AI. My
Ah,
boss is asking me. So I'd say, and like you said, at Claritas RX, we have been very mindful about this. So my biggest piece of advice would be
hmm,
start with the problem and not the technology or the algorithm. It gets
mm,
really easy to get caught up in the excitement of AI. But the most successful outcomes I've seen in patient care and risk management are the ones that begin with a specific question.
mm,
Like, why are patients discontinuing, or where are these prior auth denials happening most often? So once you have that clarity, AI becomes a tool to solve it, and not just a science experiment or something that you need to do because you need to do that and put it on your website. And then the second thing I'd say is make explainability non-negotiable. So in healthcare, people want to, I mean, this is very high stakes. You're literally talking about people's lives. So predictions that aren't understood will not be trusted. So if a team cannot see
mm,
why that patient was flagged as a high risk and what they can do about it, the insights won't drive action. And
Um,
yeah, and finally, I'd say, and this is really important, is keep humans in the loop. The best AI, I strongly believe this, doesn't replace expertise. It just amplifies it. It gets the right signal to the right person at the right time so they can step in and make a difference. So I think, if you get these three things right. So clarity on the problem, like really fall in love with the problem, not the solution, like clarity on the
mm,
problem, transparency in the model, and then the people empowered to act. AI can become a force multiplier for patient access and care. Like, sky's the limit here. And, we can do really great things together with AI.
yeah, yeah. Yeah, yeah, our robot friends. If we give them the right problems, that's awesome. That reminds me of this clip I saw. Um, again, doom scrolling LinkedIn. It was I mean, I've been thinking about this clip ever since. This clip is just so perfect. I think everyone in startups, AI, VC needs to see this clip. And right now, and it's of Jeff Bezos in the 90s or the early 2000s. He was doing an interview, and someone said, so Amazon, it's becoming so big because of this new internet boom, right? Because the internet's so big, and you guys are riding that wave, and you guys are an internet company, right? You're an internet company. That's why you're so big, because you're an internet company. And but then he's like, wait a minute. But you guys, Jeff Bezos, you guys, I see that you guys are buying warehouses, and you guys are doing all this brick and mortar stuff recently, like, and doing like, because Amazon sets up, warehouses, and they're very also like, physical. He's like, wait, but that doesn't make you as much of an internet company. Shouldn't your investors be worried because you're not an internet company? And then Jeff Bezos looked at him. He's like, dude, you're basically saying with his facial expression, it's so funny if you see it. He's like, are you an idiot? He said, no, we always put our customers first. He said, internet schminternet. And so I like, it sounds like you like have the same mindset as Jeff Bezos. It's like it's the problem, it's the customer, not just the buzzword of today.
That's really critical, especially when you're building products. It's important to, like I said, not fall in love with the solution, but really go deep on the problem that you're trying to solve, and why are you trying to solve it, and who are you trying to
Yeah.
solve it for. And that matters. The why matters.
Yeah,
Uh,
yeah. And look where Amazon is today, and that's where Claritas is going.
oh well, fingers crossed.
You're basically Jeff Bezos.
Oh, God. That might be a little far-fetched, but no, I am excited about what we are doing at Claritas RX, and the value, the impact
Yeah,
of the work that we do. That matters to
yeah,
me.
yeah. No, it's awesome. I was just drawing that similarity from
Yeah, that's fun.
that
Send
clip.
me send me that clip after we
Oh
are
yeah,
done.
right. Yeah, right away. Yeah, for sure. It's a good one. Just the way he looks at this interviewer, like it's so funny. It's so funny.
I will
Um.
definitely take a look.
Okay. Yeah. So then, yeah, I guess thank you so much for coming on, sharing your expertise and insights. You're really, really, really well spoken. Um, it's like yeah, and your experience in building these AI driven healthcare products across companies, NetSmart, Ideon, and now Claritas
Claritas
RX,
RX.
which seems awesome. It's doing really awesome stuff. It provides a really valuable perspective to me. I was very happy about this, and then to our listeners on how we can enhance the patient visibility. That's the key word of probably this podcast episode: visibility, patient visibility, patient visibility, and then the patient outcomes. So we really, really, really appreciate your time and insights. So, listeners, stay tuned for more discussions on healthcare innovation, Until next time, stay well.
Thank you. Thank you for having me.